Okay, in this video we'll learn about a disease which is called phenylketonuria. Phenylketonuria. So PKU, they can also call it PKU. So what is this disease? This is an autosomal recessive disorder. Autosomal recessive disorder. Now, as because this is an autosomal recessive disorder, what happens is this happens in the autosomal chromosome due to aberration of the chromosome or mutation or problem in the autosomal chromosome, and it is a recessive disorder. This occurs due to an absence of an enzyme. This occurs due to the absence of an enzyme. Okay, and the name of the enzyme is phenylalanine hydroxylase. The name of the enzyme is phenylalanine hydroxylase. Now, as because it is called phenylalanine hydroxylase, okay, what its function is? This enzyme's function is converting phenylalanine to tyrosine. But if it happens to be so that this enzyme is absent, then no phenylalanine will get converted into tyrosine. No. So there will be accumulation of more phenylalanine than normal, which will hence get converted into, if it is not getting converted into tyrosine, will get converted into phenylpyruvic acid. Phenylpyruvic acid, and this metabolically is harmful for the brain, harmful or brain damaging substance, harmful or brain damaging substance. So that is phenylketonuria. Now, with phenylketonuria we will learn about another disease known as the cystic fibrosis. Now, in cystic fibrosis, what happens? CF or cystic fibrosis, it is also an autosomal recessive disorder. It is also an autosomal recessive disorder. Okay. Now, what actually happens is this happens to the type of mutation known as deletion. Now, when there is deletion, there will be accumulation of glycoprotein. Okay, so there will be more accumulation of glycoprotein because the deletion of such an enzyme has occurred which would convert glycoprotein into something, but no, accumulation of it is not happening. So accumulation of glycoprotein is occurring. Due to accumulation of more glycoprotein, what happens in the ducts of our body? What actually happens is in the ducts of the liver, suppose in the ducts of the pancreas or in the bronchi, in such places there is thick accumulation of mucus. You know what mucus is, right? So there is thick accumulation of mucus. So that is the problem. So this happens in cystic fibrosis, and also another symptom of cystic fibrosis is saltier. Although your sweat is salty, but a more saltier sweat. Why this happens? Because another protein, which is a transmembrane protein, TM protein, is also not synthesized. Hence, chlorine is not transported properly across the membrane. And hence what happens? There is problem in the concentration of Na plus and Cl minus, and your sweat becomes much more saltier. So that is about cystic fibrosis and phenylketonuria.